Run It Studios and the Arthritis Foundation of Missouri bring you this special episode of the Run Radio Podcast. Welcome back to the Run Radio Podcast series partnership with the Arthritis Foundation of Missouri. My name is Trina Wilcox, and my guest today, someone who was an honoree at the Bone Bash this year, but had a wonderful reason for being absent. You had a ceremony to attend. I want to welcome Dr. Alex Garza. Thank you for being here.
Yeah, great to be here. Thank you for having me.
So tell me a little bit about how you got connected with the Arthritis Foundation of Missouri in St. Louis and some of the things that you guys are doing together to make life easier for us with arthritis.
Yeah, so I got connected with the local leadership here in St. Louis with the Arthritis Foundation, specifically around the Bone Bash. Our connection really is through the work that I do for SSM Health as the Chief Community Health Officer. And so as part of that role, we try and work with organizations outside of the traditional healthcare system. And the reason for that is that we know that the majority of issues that drive poor health out in the community really are outside of the formal sort of healthcare structure. And so that's things such as housing, transportation, education, all of those different things that really impact health. And so, and arthritis is no different than any of those other medical issues that we deal with. And so together we try and figure out ways or develop programs where we can better assist people with arthritis and with other medical conditions with those issues. So whether that's getting transportation to appointments or helping with food insecurity or housing issues, things like that, because that all contributes to poor health outcomes, including with arthritis.
So tell us a little bit about what exactly SSM Health is.
Sure. SSM Health is a not-for-profit Catholic healthcare organization, which is headquartered here in St. Louis. It's a medium to large healthcare system. It's around 10 billion in revenue. Although we're headquartered here in St. Louis, we have facilities across 4 states, including Wisconsin, Missouri, Illinois, and Oklahoma. We have 23 hospitals, around 40,000 employees, and we're a pretty diversified healthcare system.
Okay. And let's tell us some of your credentials. You've got a long list of accolades and work that you've done to move medical health forward. So tell us a little bit about that and touch on some of the COVID stuff too, because I think that's important for a lot of people with autoimmune diseases that have been affected.
Yeah. So I've done a various amount of things throughout my career. So I'm an emergency physician. That's my board certification is in emergency medicine. But I've done a number of things. I was a paramedic before I went to medical school. Did academic emergency medicine for the early part of my career, and then joined the Obama administration as the Assistant Secretary for Health Affairs at the Department of Homeland Security. Was a Associate Dean here at St. Louis University College for Public Health, where I taught epidemiology and public health and emergency management. And then moved over to SSM Health as the Chief Medical Officer. And then my current role is Chief Community Health Officer. Now, sprinkled in between there, I have a 27-year career in the military and the Army Reserves. I'm a full colonel and command surgeon for the 108th Training Command. And as you mentioned, for around 2.5 years of my life, I led the St. Louis Metropolitan Pandemic Task Force here in St. Louis, which was a group effort between the healthcare systems, public health, and various other partners to try and combat the COVID-19 pandemic.
And thank you for all of that. I'm sure that was a very interesting time in your life. What were some of the takeaways that remain with you from that experience?
Yeah, that's an interesting question. So, a lot of the takeaways are we do better as a community when we act as a community. That can become challenging at times, but I'm kind of proud of the way that St. Louis came together in the face of this incredible pandemic to do the right things for the community. I learned that healthcare and medicine is an art as well as a science, and part of that art is communications and being able to dispel myths and counteract misinformation and dealing with that in a very timely fashion. Unfortunately, healthcare has also become a political game as well, and that's where I think the communication piece becomes very important. Is when you're dealing with some false information and other sorts of things. So I think those were some of the major things, but I also wanted to touch on their significant health disparities in the community as well, and we saw that on full display during the pandemic, where parts of our community that experience extreme amounts of poverty were disproportionately affected by the pandemic, both in morbidity and mortality, but also, vaccine distribution and all of these other things that really impacted the pandemic.
How can we do better? Like you said, the community needs to come together. How can people like me and the Arthritis Foundation make a difference in that?
Yeah, I mean, some of it is larger policy issues. To be quite honest, these issues of disparity weren't created overnight, and so it'll take long, prolonged effort to turn those around. But I think at the individual and at the community level, it's recognizing that there are populations that are at higher risk, not through physical or any other issues, but because of the environments that they live in, the poverty that they experienced, discrimination that exists within the community, and working proactively to try and help with those issues on top of the regular things that you think about with delivery of healthcare. So whether that's access to care, research, all of those other things. One of the big things that I preach is that the health of an individual in a community is really, the healthcare system really only contributes about 20% to that. The other 80% is really outside of the healthcare system. And so we can't just focus on the delivery of healthcare to fix a lot of these long-running healthcare issues. It really has to be the community, business, government, all of these different entities really have to come together to fix these long-standing problems.
Are there specific things that businesses, for example, should be or could be tapping into to provide that better care?
Sure. Yeah. So some of the things that we focus on are how can we build up all communities so that everybody has access to lead their best life. And so whether that is with supporting education, supporting hiring, whatever we can do really to disrupt the cycle of poverty, especially poverty that's concentrated in certain parts of our community, I think is one of the best ways that we can help all boats rise together. And so whether that's directed hiring, directed purchasing, investing in communities, drawing attention to, what the communities need, because it helps everybody. It doesn't just help that community, it helps everybody. And we see that play out time and time again. So whether that's with, the vibrancy of the city, but I would also say it also helps with healthcare as well. So when you have a healthier population, the costs of healthcare go down because then you don't need to be doing emergency care. You don't need to be doing what we call rescue care, which is people have now become so sick that you need to rescue them.
Yeah.
And so it's whatever we can do really to improve the community of everybody, and not just those people that were around.
I want to go back to your early days in emergency medicine. That sounds terrifying to me. Why, what drew you to emergency medicine and all of those
Yeah.
impactful things?
Yeah, I don't know. I think it was, there's a saying in medicine that your discipline chooses you, and you don't really choose your discipline. So,
Okay.
so I think I don't know. I was naturally drawn to it. I think I enjoyed the fast-paced environment, the ability to interact with patients on an individual level, the variety of issues you have to deal with in the emergency department.
Mm-hmm.
Um, and and it's odd the way that I think about it, but it was really sort of perfect training ground for what I'm doing now. And the reason why I say that is it sounds odd, but I think it's very true. Is that you deal with patients that are frequently at their worst.
Mm-hmm.
So as I used to tell our staff, nobody comes to the emergency department because they're doing well.
Yeah.
It's usually because it's the worst day of their life, and they bring all of their issues with them. And so it's not just their medical issues, it's their social issues, it's their economic issues, all of these different things. And you see all the different disease states, and you see them in sort of their full display. So, for instance, patients that come in with challenges with their diabetes, whether they're hyperglycemic, so their sugar is too high, and now they're in diabetic ketoacidosis. Well, the reason for that wasn't because they want to be in ketoacidosis, because they couldn't afford their insulin. And so these are issues that, although we deal with them in emergency medicine, the foundation of them were well outside of the emergency department. And so that's why I think it was excellent training ground for what I do now in community health. And then I'll also put in a plug for being a paramedic. And I tell people that was by far one of the best experiences you can have with doing community health. And the reason for that is because you're outside of the hospital. You're treating patients in their homes and in their communities, and that's how you fully understand what's going on in their lives. When you're in a patient's house or in their apartment and you recognize that, hey, there's no food in the refrigerator, or their water's been turned off because they couldn't afford to pay the water bill, that's when you get the full appreciation of the different social factors that are impacting this patient's health.
My goodness, that's an excellent perspective. Did you plan for your career to take that route? Were you going to go a different way? Because that seems interesting.
Yeah, yeah. I used to have students come and ask me, how did you get to where you are now? And I always tell them I have no idea. Like I had,
Fair
I
enough.
have, I had no plan. When I was setting out, well, I did have a plan. My plan was to do emergency medicine my entire career.
Okay.
But different opportunities come along, and your interests shift as your career develops. And what I tell students is, take advantage of opportunities that are presented to you. Make sure that you're competitive for those, and by that I mean sometimes you have to take on different roles or do different things if it eventually leads to what you ultimately want to do. Don't be afraid to step out of your comfort zone and take on these different roles. So, I don't believe a career should be linear. I think it should kind of zig and zag, but it'll ultimately allow you to get to where you really want to be. Yeah, I had no idea when I started out that this is where I would end up, but all of the previous experiences have helped contribute to where I am now, and I'm grateful for that.
Seems pretty good. Well, it seems like the community is very fortunate to have your wisdom and compassion. Um, what what are your takes on autoimmune and arthritis specifically? What do you feel like we have to look forward to in the next 3 to 5 years, even?
Sure, sure. Well, of course, arthritis is, it's a debilitating disease that affects a significant number in the population. Especially, specifically, as we get older, you're going to develop some form of arthritis, but there's also the autoimmune side that I think is very debilitating. I think, just about everybody knows somebody, either it's a family member or friend that is affected by arthritic disorders. And so, I think the good things, or the things, we can look forward to, is continued research on therapies that impact a lot of these diseases. So there's a lot of exciting things going on in research right now that can, I think, potentially really impact quality of life, or impact the progression of disease, things like that. And that needs to be continued to be supported, both at the local and the national level. But the other things I would stress as well is to decrease the impact of arthritis is also promotion of healthy lifestyle.
Mm-hmm.
And part of that, so I will always lead this back to my community health stuff, is being able to improve the entire health of the community. So when you can do those sorts of things, whether it's with access to fresh food, or being able to exercise and do all these different things, you're going to have that downstream effect of impacting the disease state, particularly in arthritis, which, as is a huge number of people are afflicted by it.
Right. What about long COVID and arthritis or autoimmune diseases? Some of us feel very lost and just not sure if we're ever going to see the life we had again. And with all the work
Yeah.
you've done in that, what are you seeing? What have you seen, and what do you hope to see?
Yeah. Well, fortunately, long COVID is, it's still a small percentage of people that have acquired COVID. So that's, sort of the good news. The sort of challenging news is we're still trying to figure out what drives long COVID symptoms. So believe it's an inflammatory response, but exactly what causes and what drives that inflammatory response, and then how can you develop therapies to counteract that? Because there's a multitude of different symptoms and outcomes with long COVID. So whether that's with cardiac, or with neurologic, or arthritis, but the common factor is an inflammatory response. It just depends which system it's affecting. So, the good news is that a lot of people are focusing on this. But I think the more challenging piece is we're still sort of in the early phase of trying to understand it and develop therapies to slow progression, or to even eventually relieve people of long COVID symptoms. But there's a lot of research that's going on about it, and hopefully it'll produce some therapeutics going forward.
For sure. What's your partnership with the Arthritis Foundation of Missouri looking like for 2025?
Yeah, I think it's continuing to strengthen that partnership. Even specifically with what I do, it's leaning more on the community side.
Mm-hmm.
But certainly we interact with our specialists, whether it's rheumatologists or orthopedics and things like that, to help advocate for and push for therapies and research in arthritis. So I would say it's both on the community side, but also at the research side through our relationship with St. Louis University, but also at the practitioner side with our specialists that deal with patients with arthritis. But I would even say with the primary care physicians as well. So I wouldn't cut them out either. It's because they deal a lot with the day-to-day management of a lot of patients with arthritis.
All right. Well, we're looking forward to it and appreciate everything you're doing. And anything else that you want to share? Anything that we can do to be better patients?
To be better patients.
Yeah.
Yeah. Gosh, that's hard to nail down, but I'd say whenever you can take care of your entire house, you're going to end up taking care of sort of those individual health issues. So whether that's arthritis or whether that's high blood pressure or whether that's, any of a number of chronic conditions that a significant portion of the population suffer from, those are good things. And then maybe the second piece, and again, I'll go back to preaching my community side, is doing whatever we can to support the community is going to end up being better, not just for you as an individual, but for everybody. And I think that's how you improve the health of the population.
Sounds great. Thank you so much. Appreciate your time.
Thank you.
Be sure you're following along. You can find all of the podcasts linked over from runradio.net.